Have you ever felt, just completely overwhelmed by challenges in your relationship? Or maybe wish you just had a better way, a clearer path to make those important connections stronger? It's something so many of us feel. And today, we're doing a real deep dive into a really powerful tool for relationship healing, one that's backed by a lot of evidence. We're talking about emotionally focused therapy. You might have heard it called EFT. Our mission here is to unpack the great source material we've got. There's a comprehensive guide, some recent research findings, current trends too, and really pull out the key insights about EFT. Think of it like a shortcut, a way to really grasp this very effective approach. And we'll uncover some pretty surprising things, especially about how it taps into our emotional bonds to create real lasting change. So let's just start right at the beginning. If someone's hearing this for the first time, what is emotionally focused therapy exactly?
Right. Well, what's really striking about EFT is how clear and effective it is.
Yeah.
Fundamentally, it's a short-term, structured kind of psychotherapy. It was developed back in the 80s by Dr. Sue Johnson. And its main focus, its core, is really adult attachment and the emotional responses that go with that. It's all geared towards strengthening relationships. Here in the U.S., it's typically delivered by licensed professionals, think licensed marriage and family therapists, LMFTs, or psychologists. And they often work with the couple or maybe an individual or even a family as a kind of system.
Okay, so it's structured and it's about attachment. What makes it different from, say, just regular talk therapy?
That's a great question. The key differentiator, I'd say, is its really profound emphasis on emotions. Emotions are seen as the actual key to change. It's not just, talking about the surface problems. It's about getting underneath to understand and really reshape those emotional patterns. We sometimes call it the emotional dance that couples get stuck in.
The emotional dance. I like that.
Yeah, it captures how people can get locked into these cycles of disconnection. And this approach, it's actually quite broad. It works really well for romantic partners, obviously, but also for families, or even for individuals who want to explore their own attachment history and patterns. And, right off the bat, the data is pretty compelling. Over 90% of couples report feeling, more emotionally connected after going through EFT.
Wow, 90%. That's huge.
Yeah.
But, okay, beyond just feeling better, which is important, what are the sort of tangible, research-backed benefits? What does it really do for people?
Well, this is where it gets really interesting, especially, like you said, looking at the research. When we connect it to the bigger picture, the benefits are really profound. EFT works by rebuilding that core sense of attachment security, feeling safe and connected with your partner. And that directly leads to stronger emotional bonds. Intimacy increases in, like we said, 90% of couples, and it's incredibly good at conflict reduction. Why? Because it helps partners see the underlying emotional needs that are actually driving their arguments, not just the topic they think they're fighting about.
So getting to the root cause.
Exactly. And that can lower the frequency and intensity of arguments by a really impressive 70 to 80%.
70 to 80% fewer arguments. Many people would sign up just for that.
Right. And then there's communication. EFT fosters real empathy. It helps people express their deeper needs and vulnerabilities and also hear their partner's needs. So satisfaction with communication goes up in about 75% of participants. It even helps with trauma healing. It looks at how past attachment experiences might be affecting current relationships, and it helps reduce that distress in about 85% of cases where trauma is a factor.
That's significant.
And these aren't just quick fixes either. The gains tend to stick. About 70 to 75% of couples maintain those improvements years later, so it builds real long-term resilience in the relationship.
Okay, so lasting change.
Yes. Plus, there are clear mental health benefits. It often lowers symptoms of depression and anxiety, which, makes sense because those issues are really common in distressed relationships, maybe around 50% of cases. So ultimately, it boosts overall well-being. Both individual self-esteem and the quality of the relationship improve for about 90% of people who go through it.
These numbers are really compelling. How does this fit into the sort of broader picture of relationship help these days?
Well, it fits right in. I mean, we're seeing a definitely growing market for relationship counseling in the U.S. It was valued at $2.8 billion in 2024, and it's projected to grow to almost $5 billion by 2033. That's like a 6.4% growth rate each year.
Wow.
And you see the demand reflected in the job market, too. There's about 16% projected job growth for marriage and family therapists between now and 2033, with thousands of openings each year. It shows people are really seeking out these kinds of services, and EFT's consistent results, that 90% improvement rate with 75% staying improved long term, really make it stand out. We also know roughly that about half of couples attend therapy at some point, and
Okay.
specifically for EFT, appointments saw a huge jump, like a 50% year-over-year increase from 2023 into 2025. So the word is definitely getting out.
Okay, so the demand is there, the results seem to be there. So if someone's listening and thinking, all right, this sounds promising, but how does it actually work? What happens in the therapy room that creates these big shifts?
Right, the process. Well, EFT is quite structured, actually. It follows three main stages, and each one kind of builds on the last. The goal is to re-choreograph that emotional dance we talked about earlier. The first stage is called de-escalation. This is all about identifying and understanding the negative cycle you and your partner are caught in.
Okay, spotting the pattern.
Exactly. Seeing how you both get pulled into those same arguments over and over. It's less about blaming, like who started it,
Yeah.
and more about seeing the dance itself. And this stage is really effective. About 90% of couples gain recognition of their pattern, and blame goes way down.
That alone sounds helpful.
It really is. Then you move into restructuring. This is kind of the heart of EFT. Here, the focus shifts to building new, more positive ways of interacting. It's about helping partners express those deeper, often hidden needs for connection, for reassurance, for security, and learning to respond to each other in a new, more loving way. This is where you see about a 75% rate of bond strengthening.
So learning new steps for the dance.
Precisely, learning new steps. And finally, there's consolidation. This stage is about reinforcing those positive changes, making sure they stick for the long haul. That links back to the 70-75% long-term success rate. This often involves practicing the new skills, maybe integrating some exercises or homework into daily life to really solidify those healthier patterns.
Makes sense. Are there different kinds of EFT, or is it mainly for couples?
That's another good point. While it started with couples, there are popular variations now. There's EFT for individuals, which people call EFT. That's really growing and showing high success for people working one-on-one, focusing on their own attachment patterns and maybe healing past stuff. And there's also EFT for families, or EFFT. That applies the same core principles to family dynamics, and it shows about an 80% improvement in family connection. Interestingly, EFT has adapted really well to things like telehealth in 2025.
Telehealth, so you can do this online.
Absolutely. That's a big trend. We've seen about a 50% rise in what's called tele-EFT. It makes it way more accessible and kind of futuristic, but there's even some early use of AI-assisted tools to help therapists spot those relational patterns even faster.
Fascinating. Okay, so that gives a good picture of the how. Let's talk about the when. When should someone listening, when should you maybe consider this kind of therapy? Are there specific signs?
Yes, definitely. EFT is particularly recommended in several common situations. If you're feeling that sense of emotional disconnection, like your roommates rather than partners, which affects maybe 40% of couples, EFT is great for that.
Okay.
It's also really powerful for rebuilding trust after, say, an infidelity. That's a factor in maybe 20-25% of cases seeking therapy. And for breaking those really frustrating cycles of criticism and defensiveness, the arguments that go nowhere, that's super common, maybe in 50% of recurring arguments.
Right, those endless loops.
Exactly. And interestingly, it's also really beneficial proactively. For premarital couples, for instance, research suggests it can lead to about a 30% reduction in divorce rates down the line if couples do it beforehand.
Preventative maintenance for the relationship.
Kinda, yeah. And the official guidelines from the AAMFT, the American Association for Marriage and Family Therapy, for 2025 actually recommends seeking therapy at the early signs of distress. Don't wait until things are really bad. Addressing things sooner is always better.
Good advice.
Yeah.
Okay, so what about the practical side? If someone decides to try it, what should they expect? And what about things like cost and doing it online versus in person?
Good practical questions. Okay, so what to expect? Usually the first few sessions involve assessment. The therapist will want to understand your relationship's history, your cycles, your attachment styles, that kind of thing. Sessions typically last between, say, 45 minutes to maybe 90 minutes. And often, yeah, there might be some homework, maybe tracking your emotions or trying small behavioral experiments between sessions to help you notice patterns in real life. And like we mentioned, virtual sessions are a big thing now. They're fully compliant with all the health privacy guidelines, the HHS rules, making it much easier for many people to access therapy.
And the online versus in-person debate.
Right. So online EFT has surged, like that 50% increase shows. There are platforms like Regain or Talkspace offering couples therapy, sometimes around $65 to $100 per week, which can be more affordable. It offers huge convenience. That said, some people and some therapists still prefer in-person therapy for the perhaps perceived depth of connection or the ability to read nonverbal cues more easily. So it's really a personal
And the
choice.
cost generally, what's the typical range?
Typically, an in-person session might range from $100 to $250, with the average probably around $150. Online can sometimes be a bit lower, maybe starting around $40 on some platforms, up to, $275 for very specialized
Well,
providers.
what about insurance? Does it usually cover couples therapy?
Insurance. That's often tricky for couples therapy specifically. Coverage is, frankly, still limited. However, a positive development is that Medicare coverage for licensed marriage and family therapists is expanding in 2025, which is great news. But beyond insurance, many therapists offer sliding scale fees based on your income. And don't forget about employee assistance programs, EAPs, through your workplace. They often provide a certain number of free or low-cost sessions, so there are ways to manage the cost.
That's good to know there are options.
Hmm.
Now, with any therapy, there are always myths or misunderstandings that float around. Let's tackle a few common ones about EFT.
Yes, let's bust some myths. Okay, a common one is that EFT is only for married couples.
Right.
But the fact is, as we discussed, it works really well for individuals with EFIT and for families with EFT too. It's about attachment, and that applies across different relationships.
Okay, so broader than just marriage. What else?
Another one you hear sometimes is that EFT is too emotional or too touchy-feely, maybe.
I can see how people might think that.
Yeah, but while it absolutely focuses on emotions, it's actually a very structured approach. It doesn't just let emotions run wild, it guides you through them constructively. That structure is why it's so effective, why we see that 90% improvement rate. It helps you understand and use your emotions, not be overwhelmed by them.
Good clarification. Any others?
The cost myth. That EFT is just flat out too expensive. And while therapy is an investment, as we just covered, there are options. Sessions can start around $100, sometimes less online. And with sliding scales, EAPs, and maybe some insurance help eventually, it's often more accessible than people assume. You just need to explore the options.
All right, myth busting complete.
Yeah.
So if this deep dive has resonated with you, if you're thinking this might be helpful, what's the actual first step? How do you find someone qualified, someone who really specializes in EFT?
Great question. The best place to start is usually trusted resources. The International Center for Excellence in Emotionally Focused Therapy, that's ICEFT, they have an online locator for certified therapists. Psychology Today is another good resource. You can filter by specialty. The key thing is to verify their certification. Make sure they've actually had specific EFT training, not just list it as an interest.
Are there, like, well-known names people might recognize in the field?
Oh, definitely. I mean, obviously, Dr. Sue Johnson, the founder, is still very active, offering workshops, often virtually. Another really respected figure is Dr. Rebecca Jorgensen. She's a prominent EFT trainer and supervisor, known for her work integrating trauma into EFT for couples. Those are just a couple of examples, but it shows the high caliber of specialists dedicated to this approach.
Good to know there were real experts leading the way. And what about the legal side, confidentiality and all that?
Absolutely crucial. You should know that rigorous legal safeguards are in place. IPA, the Health Insurance Portability and Accountability Act, is the main one protecting your health information, what they call PHI. There are actually new security proposals expected in early 2025 and updates to the privacy rule later in the year, constantly strengthening those protections. So confidentiality and ethical practice are paramount. You can feel secure engaging in the process.
Okay, so wrapping this up, our exploration today really shows that emotionally focused therapy isn't just another therapy trend. It seems to be a genuinely powerful, evidence-based way to transform relationships. Those success rates, 90% improvement in satisfaction, 70–75% maintaining those gains long-term, are really hard to ignore. Its focus on our core emotional bonds and attachment patterns seems to be the key to helping individuals, couples, families move from distress to, well, deeper, more secure connection.
Absolutely, and it makes you think, doesn't it? Knowledge like this is useful, but it's most valuable when you actually, understand it and think about how it applies. So I'd encourage you, listening, to consider how these EFT principles focusing on emotions, understanding attachment needs, recognizing those patterns, how might they apply in your own life, in your relationships, or even just in how you understand human connection generally. It's a really insightful framework.
It's a great point. And it leads to a final thought, perhaps. Given how much EFT emphasizes recognizing and then changing that emotional dance we do,
Hmm.
Consider this. How might just becoming more aware of those emotional patterns in your everyday interactions, even completely outside of therapy, how might that alone fundamentally shift how you approach connection, how you handle conflict? Something to mull over. And of course, if you want to explore further, check out the resources we mentioned, like the ICFT Locator and Psychology Today. They're excellent starting points.